from the radial nerve. All right. So slide. Now the posterior aspect is having the triceps muscle. The triceps, it has three heads. It has a medial head, it has lateral head, and it has a long head. All right. If you guys look at the triceps, all right, so you're gonna find the long head that goes to insert into the infraglenoid tubercle, and then you have lateral head that comes out from the lateral border of the radial groove. Remember, you guys, in the humerus we had a radial groove, that where you have the radial nerve passing through. If I have a groove, it means there is an elevation on both sides of that groove. All right. So which muscle is in the posterior arm? It's the triceps. So which muscle would be elevating and making that groove? It's gonna be one of the two heads of triceps, because I only have triceps back there. All right. So what would be in the lateral border of the radial groove? It's gonna be the lateral head. And what's gonna come out from the medial border of the radial groove? It's gonna be my a medial head. Where is the medial head? Here I cannot see it because it's covered by the long head of triceps. I need to remove this so that you can see the medial head. So what you can see here is the lateral head and the long head of triceps. So these are the triceps. And where do they attach themselves? Into the olecranon process of ulna. Why do we call it olecranon? Because olecranon means elbow in Latin, and because you guys you will see it now, this process is basically making your elbow. So that's why they call it olecranon process. And what does it do? It causes forearm extension. What is the innervation? All the muscles of the back of your arm, your forearm, your hand is supplied by radial nerve. But as we get down, we will be specific on which branches that do they supply. But for now, this is supplied by the main trunk of radial nerve, because up until this point, the radial nerve did not divide. Okay, it's gonna divide down. Not at the point of the triceps. Okay, so it's innervated by the radial nerve. Now there is a very important concept we need to mention here. It's basically the spaces. Why do we need to know about the spaces? Because you know guys, we have structures in the axilla, and then we want to go to the arm posteriorly. So we need to have spaces that helps us to come out of that region to another region. How will you know the spaces and how will you remember them? I want you guys right now to do your right arm, right hand and left hand this way, and I want you to put them on top of each others. If you do your hands that way, it will end up giving you three spaces. It's gonna give you a superior triangular space, it's gonna give you a quadrangular space above, and it's gonna give you a lower triangular space. What are your fingers representing in that? You guys, what's happening here is basically your left hand is giving you the teres muscle. One will give you the minor and one will give you the major. And the right hand, one of them, the index finger, will give you the humerus, and the middle finger will give you the long head of triceps. All right, so the long head of triceps is here, and the humerus is your index finger. Now once you do that, you will have upper triangular space, you have quadrangular space, you will have lower triangular. Let's see this. You will have, this is one finger, this is one finger, this is another finger, and this is one finger, and this is another finger. So that will end up giving you triangular space above. All right, it's gonna give you a triangular space above, quadrangular space, and then triangular space below. So what are these? So now you guys know the borders. You know they are the teres minor and major, and then the right hand is giving you the humerus and long head of triceps. All right, now what is gonna pass through them? We talked about that. Remember your humerus, guys. What was there in the humerus? I had above the surgical neck, and I had below the radial groove. What were the structures that are related to the surgical neck? It was the axillary nerve and the posterior circumflex humeral artery. Remember, that was the quadrangular space. And what is related down to the radial groove related to the humerus? Remember, it's the profunda brachii artery and the radial nerve. So these are the structures that are being transmitted through these places because they want to reach the posterior compartment. And what about the upper triangular space? It's gonna give you a space for the circumflex scapular artery. All right, remember that we had the circumflex scapular coming from the subscapular because it wants to reach the scapula. It runs back. So thanks to the upper triangular space, it's gonna give me that gateway to come out of that axillary region and reach the scapula posteriorly. All right, so these are the structures, these are the borders, and they are very important. All right. Now this is another picture of a real cadaver showing you that above you have one nerve, one artery, and that is the axillary nerve and the posterior circumflex humeral artery. Below you have the profunda brachii and the radial nerve. And from the upper triangular space, you have the circumflex scapular artery. All right? Now moving on to the elbow joint. The elbow joint, guys, the elbow joint is just basically between your lower part of humerus and the upper part of radius and ulna. Now we need to talk about the lower part of a humerus and what makes it different. If you guys look at the lower part of your humerus, you will find that you have condyles, and the condyles here, you guys, condyles in Latin means articulating smooth surface. This is what we mean by condyle. But because they have a specific looking in the humerus, we give them different names. It's not like the condyles of femur. Condyles of femur, we will call them femoral condyles, and that's it. But in humerus, because one of them looks like a trochlea and one of them looks like capitulum, we give them those names. What does trochlea mean and what does capitulum mean? Trochlea in Latin, you guys, means pulley. Because why? Because your ulna is rotating around the trochlea, exactly like the pulley system. So that's why this is the trochlea, and the olecranon is wrapping around the trochlea, and it's making you to flex your elbows and extend your elbow. Can you guys see this? All right, so this is basically part of your olecranon process. This is the whole process, and the notch is what is accommodating the trochlea. That's why we call it trochlea. All right, and you guys, because you know that your ulna is near to your body, it's medial, so the trochlea, part of the condyle that is medial to my body, and the very huge elevation above that is what we call the medial epicondyle of a humerus. And you guys know that the medial epicondyle of a humerus is bigger than the lateral epicondyle. The medial epicondyle of a humerus, it's bigger than the lateral epicondyle. Can you see the medial? You can just palpate it on your own self now. You can touch it on your body. You can feel that the medial epicondyle is bigger than the lateral epicondyle. So the condyle, that is the part that's making your joint near to the medial, is the trochlea. Here is going to the olecranon notch is going to rotate around it. All right, and that is near to your medial epicondyle. Epicondyle above the condyle, and when I have above condyle elevation, it means this is an area for muscle attachment, and we're going to talk about that in forearm muscles. And if I have a condyle, it means this is making my joint, because this is what condyle means in Latin. Now what about the other part, which is the capitulum? The capitulum, you guys can see it from the anterior aspect, and that is accommodating the radial head. Can you guys see the head of radius? Because when you want to flex your elbow, even the radius also wants to kind of rotate. It's not full rotation, it's just that part, but it's gonna wrap around this area. It's gonna rotate around this area, the head of radius. And then what does capitulum mean? It means the bulging part of the center of the flower. This is what capitulum means. So because that part is a bulging part, looks like a center of a flower, they call it capitulum. Okay, so the trochlea, you can see it from anteriorly and posteriorly. And up above that, you have the olecranon fossa, because that wants to accommodate the process, your olecranon process of ulna. But anteriorly, if you look, you can find trochlea near the medial epicondyle. You can see capitulum near the lateral epicondyle, and you will have depressions. You will have depressions for the processes of ulna and radius. What are these processes? Let's go ahead and see. First of all, I want you from this picture to know how to identify, how to orient yourself in the humerus. If you guys look at the lower end of humerus, I told you when we talked about the proximal end of humerus, how to differentiate between anterior and posterior by the head. The head is facing medially. Now, if you look at the lower humerus, you will find one huge depression only on one side. This is posterior side, you guys, okay? Because here your olecranon process is gonna fill in this area here. Okay, this is your elbow. Olecranon means elbow. So this is your elbow. This is the bone. The olecranon process is the bone that makes your elbow. You can touch it on yourself now. If you look anteriorly and you find the trochlea medial, here is the medial epicondyle. This is the medial aspect. This is a bulging part like the center of a flower. It's the capitulum. It means this is trochlea, this is capitulum. I have fossae above them. One is called coronoid, one is called radial. I will tell you why we call them as such. This means this is the anterior aspect of my humerus. This is only one fossa for the olecranon process. We call it olecranon fossa. Okay, so this is posterior and this is anterior. All right, now this is what I wanted to tell you, that the olecranon, this is your elbow, guys. So olecranon in Latin means elbow. This is the bone that comes in and it fills. Can you guys see how it gets into the olecranon fossa? So olecranon process, olecranon means elbow. This is the process of the ulna that will make your elbow joint. It has an elevation, a process. It has notch, and there is fossa on the humerus to accommodate the process itself. So the process needs to get into a fossa. What we have in the humerus is only fossae. Okay, we have posteriorly one fossa, we have anteriorly two fossae. Okay, fossae is plural to fossa, so that you don't get confused between fossa and notch. If you are in the bone itself, ulna, the upper part of the ulna, you have the olecranon process, you have notch, and you have a coronoid process. What do we mean by coronoid? It's a coron-like. Coron means crown. Okay, it means a crown. So it's elevated as a crown. So this is coronoid process, olecranon process because it makes your elbow, and this is the notch. Now, posteriorly in the humerus, I have olecranon fossa. Okay, so it will accommodate your olecranon process. Anteriorly, trochlea, capitulum. Above them, we have the trochlea. You have the trochlear notch here. You have the trochlear notch here. So in the elbow, the ulna, you have trochlear notch to accommodate your trochlea, and the capitulum meets your head of radius. It rotates around it. And then above them, you have fossae. Okay, so above the trochlea and capitulum, you have the coronoid fossa for the ulna and radial fossa for the head of radius. That way, when you flex your elbow, everything finds a place to rest inside. And posteriorly, the olecranon process gets into olecranon fossa. Okay? Now, if you look at the ulna and radius again, this is the ulna and this is the radius. This is the radial tuberosity, and also we have ulnar tuberosity, which are the attachment of the biceps and brachialis, like we said. Then you have the trochlear notch. Okay, you have trochlear notch. You have outside the olecranon process, you have your coronoid process. All right. So in the ulna, olecranon process, trochlear notch to accommodate the trochlea, and it rotates around the trochlea medially. And then the coronoid process to get into the fossa above the trochlea. Coronoid, it's a coron-like. And laterally we have the radius, it wraps around the capitulum, it rotates around the capitulum, so the radial head rotates around the capitulum here, and you have fossa above it, we call it radial fossa because the radial head rests in that in full flexion. And this we call it olecranon fossa because the coronoid fossa because the coronoid process of ulna rests in that in full flexion. And in full extension, the olecranon process rests on the olecranon fossa of humerus in full extension. So each one of the processes of the forearm rests in one fossa of the humerus, one posteriorly olecranon, two anteriorly coronoid and radial. All right? Great. Now let's talk about the